Hi y'all! 5 things to know about pregnancy in Sierra Leone. 5 things to know about pregnancy in Sierra Leone. I'm Dr. Fatou Forna. I'm an OBGYN who works to keep pregnant women safe in the US and around the world. So today I am in beautiful Freetown, Sierra Leone. This is my home. This is where I'm from, where I was born. I moved to the US as a teenager in high school. I now split my times between the US and Sierra Leone, working to reduce maternal death. So, I'm really excited to be home and show it to you. Sierra Leone is known for its beautiful beaches. It's called the Diamond of Africa. It has some of the most beautiful beaches in the world. Beaches with white sand and black sand and gold sand and pink sand. I am at a beach called Toke Beach, and is on that side. And then when I turn around, number 2 River Beach is on the other side. So I wanted to show that to you and showcase one of the most beautiful places for this video about Sierra Leone today. So let's talk about pregnancy in Sierra Leone. Sierra Leone is a small country in West Africa, a population of about 8 million people. We have about 300,000 babies that are born every year. In comparison, the US has about 3.6 million babies born every year. So interesting facts about Sierra Leone. It used to have one of the highest maternal mortality rates in the world. A maternal mortality rate that was over 1,000 in around 2013 or so. But the country has done amazing work and has significantly decreased her maternal mortality. Most recently in 2020, the maternal mortality had decreased to about 400. So from over 1,000, 1,200 to 400 in the space of 10 years is truly remarkable. So that was number 1. Number 2, let's talk about the C-section rate. Sierra Leone has a very, very low C-section rate, 2.9%. Again, one of the lowest in the world. Africa in general has low C-section rates. And when a C-section rate is that low, that kind of reflects that the country, has some challenges with having the right number of doctors and hospitals and blood and medications and anesthesia, all of those things needed to have safe cesarean section. So that's a challenge that happens in Sierra Leone. In comparison, for example, the US, the C-section rate is about 30%, which is relatively high. But countries, according to the World Health Organization, countries need a C-section rate somewhere around 10 to 15% to adequately provide for complications that women and children face. So number 3, let's talk about universal health coverage. That's when a government or a country provides health care to its citizens at an affordable enough rate that everyone can have access without bankrupting themselves. So Sierra Leone does not have universal health coverage yet. They're moving towards it. But one of the things that the government does have, they started in the, 2008 or so. They provide free health care for all mothers, all pregnant women, and all children under 5. So that is really exceptional. That's actually one of the big reasons why the maternal mortality rate decreased so drastically in the past decade, because women stopped delivering at home and they came to health facilities because now it was affordable. So that's huge that the government has free health care for women and children, and pregnant women specifically, and is working towards universal health coverage. Let's talk about paid maternity leave. Sierra Leone does very well. 14 weeks of paid maternity leave for women when they're pregnant. That's really good. Compared to the US has 0 weeks of paid maternity leave, so kudos Sierra Leone. And then let's talk about disparities. Everyone's black in Sierra Leone, or nearly everyone is black. So there is no racial disparity per se, but there is some disparity based on income. Poorer women struggle more. Also, rural versus urban women in rural areas struggle. So Sierra Leone is a low-income country. Used to have one of the worst maternal mortality ratios in the world, but now doing much, much, much better. And I think Sierra Leone shows what is possible when a government and a people decide that maternal health is a priority for them and put in the resources and actually put in an effort to decrease in the maternal mortality. And Sierra Leone has shown that you don't need just money to do it. You could do it with will. Yes, money is needed, but you can do it even if you're relatively lower income. So, kudos to Sierra Leone. I think they're showing a lot of the world what is possible. I'm very proud of them. We've been a part of this work also. One of the things that I actually need to add is Sierra Leone does not have a lot of doctors and midwives when you're talking about the maternity workforce. Sierra Leone about a decade ago had about 300 midwives. They now had 1,500 midwives, so that's part of the effort that has gone into this. Just about 3 or 4 years ago, they had less than 10 OBGYNs in the entire country. Some of the work that I'm doing with my foundation, the Mama Pekin Foundation, is we're helping the government to train obstetrician gynecologists and pediatricians for the country. So we're training the first ever set in the country. We had 3 pediatricians graduate this year, and we're on track to have 8 OBGYNs graduate next year. So a lot of work is going to trying to get women to deliver in health facilities to help improve the workforce. And I'm really, really very proud of Sierra Leone. So Black women, I'm sharing these stories. When I go around the world, I like to talk about what countries are doing so we can learn from these, because I want all of you to survive and thrive. But now I'm going to show you a little bit more of our beautiful beaches in Sierra Leone. And if you ever have a chance to come visit my home. We're warm people. We're called the Diamond of Africa, not only because our country is shaped like a diamond and because we have some of the biggest diamonds in the world. We're found in Sierra Leone, but because our people are brilliant, they're warm, they're shining, just like diamonds. So hello and goodbye from beautiful Sierra Leone in West Africa.